day.
All right, stay with us here on Breakfast Central. The program continues, and of course, there's so much more of these discussions that we're going to be having this morning.
I want to reassure Ugandans and all residents that the government has got capacity to control this outbreak as we have done before. Therefore, there is no need for anxiety, panic, restriction of movement, or unnecessary closure of public places like schools, markets, places of worship, etc. as of now. This virus we can fight it more easily than corona, because number one, it does not go through the air.
Well, that is the Ugandan President Yoweri Museveni ruling out the possibility of imposing a lockdown to contain the highly contagious Ebola virus, saying the country had the capacity, or has rather the capacity, to contain the outbreak. Authorities in the East African nation declared an outbreak in the central district of Mubende last week after the country reported its first fatality from the virus since 2019. According to the Health Ministry, the caseload currently stands at 24, with 5 confirmed deaths.
Leila Bale is in Uganda for us this morning, and she'll be joining us to discuss further on this. Thank you so much for being here, Leila. Give us your assessment of what the president said yesterday regarding this virus ravage in Uganda, and what are the people of Uganda saying about this?
Thank you so much. Many were worried about a possible lockdown. We all know during the COVID-19 pandemic, the 2 years of the lockdown greatly affected all Ugandans. All sectors of the economy were greatly affected by the restrictions following the outbreak of COVID-19 in March 2020. But now with Ebola and the president assuring the nation that there is no possible lockdown and the viral hemorrhagic fever will be contained, it brings joy and hope, as well as a relief to many Ugandans and all those in other sectors, including the education sector, the tourism sector, the industrial sector, agriculture sector, and all other sectors that were previously affected by the 2-year lockdown for the COVID-19 pandemic. It was a sigh of relief for everyone, just like I've told you, and now businesses have continued to operate. Many Ugandans were worried about Ebola, and some thought maybe they didn't know how it is basically transmitted. But now, with the president assuring the nation that it only requires you to wash your hands with soap and clean running water, many Ugandans are practicing that, despite the fact that the prices of commodities are a little bit high, with soap being at around, a bar of soap costing at around $2 for Ugandans. Some cannot afford that, we agree, but many families can afford, even if it is a smaller piece of soap in their homes, such that they can wash their hands and avoid this. The biggest issue that we are currently seeing here in Uganda is contact tracing. Many people who are suspected to have the disease, out of fear, out of shock, out of stigma, are running away from health centers. And some people are even hiding their relatives, because the president yesterday told us that at least 19 probable deaths have been registered in the country. These people were buried. Imagine the number of people that attended the funerals, the number of people that basically were there to treat these bodies and all that, especially for the family members. It is now worrying some Ugandans. So, but the government said contact tracing is being done, and over 450 contacts have so far been traced throughout the entire country, which brings hope that these people will undergo treatment after being tested in case they are positive.
Well, I also want your assessment of the president and his understanding of the challenge, with regards to Ebola. He seemed to, make it seem like it wasn't, such a problem, comparing it with COVID and saying that, well, at least it's not airborne and things like that. I don't know, what you think with regards, or what level of confidence you have, and of course the people of Uganda have, in his understanding of the problem here. And of course, you've already mentioned contact tracing. More than 400 people that need to be, well, identified and maybe also monitored. Do you think Uganda can do that effectively?
I believe this time Uganda can. From the past experiences of the Ebola outbreak, with the latest being in 2019, I believe Uganda can, because the government has already redeployed the medics that helped to fight the 2019 Ebola outbreak in the country to join efforts of the current medical team that is on ground to help in the treatment as well as contact tracing and all other measures that are put in place. What brings some confidence in me is that Uganda, it isn't its first time to contain such an outbreak. We've been able to contain previous outbreaks of Ebola since 1979. So I'm very sure even this time the country can. So long as Ugandans are working closely with the government, if someone really has the signs and symptoms and decides to go to health facilities to seek medical attention, that could really help us. But usually the problems comes with some people who do not want to go to seek medical services because of, especially when it comes to stigma and the fear that you create in society. Whenever they find out that in such a family or in such an area, there is a suspected case of Ebola, that fear that comes with only hearing about the word Ebola, it is the biggest challenge that we have. But with the medics that are on ground, I believe we will be able to handle this pandemic, and within a few weeks, we'll wipe it out of the country.
I really do hope that is the case. Thank you so much for your time, Leila Bale. Do take care of yourself and stay safe in Uganda.